Welcome to part 2 of the admissions procedures. You know, I forgot to give you your keyword for the last segment in the first part of the admission procedures. So that keyword is the word waiver. So write down the word waiver for the keyword for the last segment. And there's only just the one keyword. So let's continue on with the radiation therapy admission procedures. The next thing after the waiver form is the applicant must complete the information acknowledgement form. That's just a basic form that tells us that you've received information about the radiation therapy program, which actually I think is kind of a silly little thing, because if you've filled out the other forms, then it seems to me quite obvious that you've received information about the radiation therapy program. Nonetheless, I don't make the rules, I just follow them. Moving along to the next one. The student or the applicant must possess all of his or her civil rights at the time of application. Basically, anything more than a minor traffic violation would have to be reported to the agency listed in the packet, the RRT, and then you have to go through a little song and dance routine to kind of make sure that everything's clear and okay with that. My concern is that this needs to be checked out. If you have any concerns, it needs to be checked out ahead of time, because the worst thing that I can think that could happen would be somebody going through 2 years of the program, spending all this time and money going through the program, and then come to find out that after they graduate, they apply for their license, their registration to practice radiation therapy, and they're denied for reasons of past background stuff. So you want to find out if things are going to be okay before you even enter a radiation therapy program. So if you have any questions or concerns, use the contact information listed in the application packet. Also, any student that is accepted into the radiation therapy program will also be instructed upon their acceptance to undergo a criminal background check. So you would receive information about how to go through that. It costs like $55, $60, something like that. And that is not actually a requirement of the college, it's a requirement of the hospitals that we send our students to. In order to maintain their accreditation, they have to have anybody working with patients go through a criminal background check. So that only applies if you're accepted in the program. Then you'll receive information about how to do that once you're accepted in the program. Kind of like the TB test and the the hepatitis B stuff as well. That's only applies once you get accepted into the program. The next one is the applicant must attend the orientation or go through the orientation, and you're doing that right now. And let me go ahead and give you a keyword for this orientation: scarecrow. I don't know what made me think scarecrow. Just that's the keyword, or a keyword for this particular segment right now. The next one is the applicant must have good personal health so as not to pose a safety risk to patients or personnel. Mostly what we're thinking about there or concerned about is things like back problems, knee problems, things that prevent you from being able to perform the day-to-day routine physical activities of being a radiation therapist, which frankly I don't think is that terribly physically demanding of a job. I mean, I worked my way through radiation therapy school in part at a McDonald's, and that was actually much more physically demanding, I think, than radiation therapy. So anybody that's accepted into the program will be sent a form along with their acceptance letter where they have to state, yes, I can do this, that, or the other, and there are things like, yes, I can stand on my feet 8 hours a day. Yes, I can lift 30 pounds over my head. Yes, I can lift 50 pounds from the floor to the level of my knees. Yes, I can see and read in modestly low lighting. If you've done your clinical visit, or when you do your clinical visit, you'll see that many of the radiation therapists will turn the lights down a little bit so they can see the little red light or green light lasers that they use to position the patients easier. You just have to kind of be able to see in somewhat low lighting, but it's really not all that low lighting. You have to be able to see the words that are written on the computer monitor screens and see the keyboard and be able to physically punch the keyboard as well. You don't have to be a proficient typist to operate the keyboard in radiation therapy. Again, as I mentioned before, you really kind of need to have some decent typing skills in order to complete your online work in a timely manner. But to just operate the equipment, it doesn't take really super deluxe typing skills at all. But you do have to be able to physically hunt and peck and find the keys and push them at the right time. So those are the kinds of things that we primarily look for as far as being able to perform the physical day-to-day routines of the job of radiation therapist. The next thing is the applicant must visit a local radiation therapy department and observe its operation for a minimum of 4 clock hours. This is a career decision for you. Many people don't really know a lot about radiation therapy or what it is. So what we want you to do is go and visit a radiation therapy department and watch what we do for a minimum of 4 hours. And then just get that documented on the clinical site visit sheet that's down the road. And it'll be talked about a little bit later as well. So whenever you are ready, you can do this really anytime you want. If you're in the Amarillo area, then whenever you're ready to do the clinical visit, contact me and let me know that you're wanting to do that, and I will then reply to you and let you know the contact person at the hospital to go to, and how to contact them, and some other instructions as well. If you're in the Lubbock area, again, contact me and I'll tell you who to contact in the Lubbock area to do your clinical visit. If you're outside of the Texas Panhandle, if you're outside of the 806 area code, then you don't have to contact me at all. You will be completely responsible for finding a radiation therapy department fairly close to you, or as close as you can get, contacting that hospital or that department, and setting up your clinical visit. When you contact someone at a hospital, really I would suggest just calling the hospital's main number and ask to speak with the radiation therapy or radiation oncology department. And then once you get that department, ask if you can speak with the radiation therapy director, or they might call them the radiation oncology director. Or you can ask to speak with the radiation therapy chief therapist, the chief tech or chief therapist. And that might even be a more appropriate person to talk to. Either way, it'd be okay. And then once you get that person on the line, just diplomatically and politely introduce yourself and say that you're applying for a radiation therapy program, and that one of the requirements of application is to do a job shadow or do an observation for a minimum of 4 hours, and just kind of set up that visit. I also recommend, highly recommend, you need to ask them if they have any particular dress code requirements for you to be aware of during your visit. So just be mindful of that as well. If you're doing your clinical visit in the Amarillo area, then there are a number of things to kind of be mindful of in terms of dress code. Basically, if you'll just wear business casual or better, like a shirt with a collar and trousers like what I have on right now. These are kind of like Docker style kinds of trousers, and kind of dress shoes. Ladies wear flats. I also recommend ladies, I guess it's okay if you wear skirts, but really wear pants. It just works a lot better in the clinic. It's just easier to walk around in and stuff. So pants, flats. We say recommend people minimize or actually just eliminate perfumes and colognes, because some of the patients are very sensitive to perfumes and colognes. So be mindful of that. Also, if you wear earrings, then only studs, and only a maximum of 1 stud per ear. Don't wear any dangling, looping kind of thing, because that could be a hazard if you're helping a patient off the treatment table or something, and if they grab your hair, then that's maybe kind of uncomfortable. But if they grab a dangling earring, then we're talking a big painful mess, and don't go there. So that's pretty much about it as far as the Amarillo area goes. So just contact me whenever you're ready to do your clinical visit in the Amarillo or Lubbock area, and I'll forward along who you should be contacting at that time. I think that just about does it for the admissions procedures. The last keyword for this one, for the admission procedures, let's see, how about clinic? That'll work. Clinic. So I'll see you in the next segment.